The following case shows primary care clinicians can engage patients and family members to address health conditions that do not have an identifiable physical cause. Family engagement can occur at any of the following 5 levels. This video illustrates a level 3 intervention, feelings and support. In the video, you will see a medical clinician ask questions that elicit the patient and family members' concerns and feelings. Notice how the clinician uses empathic listening and normalizing skills. Here is a genogram of the patient and family. The genogram displays a person's family relationships and medical history. The patient, Christina, is a 39-year-old mother and wife with family history of heart disease and diabetes. She lives with her husband Miguel and 2 boys. She is very close with her mother, but not close with her sister. The patient is returning after a recent exam visit for unexplained dizziness. The purpose of today's visit is to start medication and schedule a follow-up visit.
Good morning, Christina. How are you? How's your dizziness?
I haven't noticed a difference since it started a few days ago. It comes on so suddenly, I can barely stand. It eventually goes away, but it keeps coming back several times a day. Like right now. I was fine this morning, and then when I was in the waiting room, it started again. I'm scared I'm eventually going to pass out.
That must make it very hard to go about your day. Who's in the home with you? Is there someone who is able to help you?
My husband and my 2 boys. My husband helps a lot. He drove me here. He'll be back when I'm finished here to help me go home.
Good, good. And you haven't noticed any other symptoms, not feeling sick or nauseous otherwise?
Yes, no other issues, and especially nothing like this.
Well, the good news is I have not found any signs of more serious conditions that cause vertigo. Your blood pressure looks good, eyes are clear, and there was nothing of concern that I found during your exam on Monday. I know I saw you last year for a physical, and you reported no history of other health conditions. Is that still correct?
Yes, no other issues, and especially nothing like this.
Okay, looking at the results of your blood work from Monday, there is a slight decrease in your white blood cell count. This means it could be an infection. Since you're experiencing vertigo, the most probable cause is an infection of the balance tubes next to your ears. We call that labyrinthitis.
What caused the infection?
It's the time of year that flu, colds, and upper respiratory infections are spreading around. You may have picked up something and it caused the infection. I know you have no other signs of feeling sick, but I think that is most likely the culprit. Sometimes people pick up a virus and don't show many symptoms. You should also be aware that your husband or kids could end up with flu-like symptoms.
So what do I do about that? Is there medicine or something I should take?
It should go away in a few days. I'll call in a prescription for you for some tablets that should help with the dizziness.
I hope so. This is terrible.
Until that time, it's a good idea to have someone around to help you. I'm glad your husband is driving you home. You should avoid driving and alcohol as much as possible while the dizziness persists.
That's not a problem. My mom also said she could help if she needs to.
It's good to hear they're able to help out. Hopefully, it should just be for a few days, and then you should be feeling better. So I'm going to just document what we have talked about and what we're going to do next. Is that all right?
Yes, that's fine.
All right then. So I'm adding a summary of what you've told me about your symptoms and what I see in the test results. I'm also putting the current diagnosis of labyrinthitis.
And it should go away in a few days, right?
Yes, it should.
That's good. I have a lot to catch up on. I have to keep up with my mom. She's diabetic and is having a hard time keeping up with the dietary changes she has to make. And I'm over there most of the days of the week to help out with meals. Plus, I have the kids. They're always all over me, and I can't even hold them right now.
You have a lot of people depending on you. Is it difficult to manage everything you have on your plate?
I don't mind it usually. I like helping out. I like being there for them. It bothers me that I can't be there for them now like I need to. I feel like I'm letting them down.
Are there things that you do for yourself, like activities or hobbies? that you enjoy?
No, I rarely have time for it.
I'm sure it can be hard to have so many responsibilities and not being able to do everything that you normally could. It seems like it is stressful and it's making you feel a little guilty, but it is important for you to have some time to yourself to do things that you enjoy and rest. So maybe have a conversation with your family about ways to lean on them, or at least for a few days, so you can, have a break, not only physically, but mentally as well.
I mean, you're right. I can try. I'm not sure it'll change completely, but maybe it'll help a little bit.
Okay, so the plan is to talk with your family members about ways to help you out so you can get around safely and rest more. I am also writing a prescription for Dramamine to help with the dizziness until the infection clears up. Call us next Monday to let us know how you're doing, okay?
All right. Thank you, Dr. Alvarez.
Good morning, Miguel. Good to see you again. Christina, is Miguel staying in here with us for the visit?
Yeah, I would like for him to stay.
Well, from the phone call this morning, I understand that the dizziness has gotten worse.
Yeah, the pills didn't do anything. She's clearly gotten worse. She could barely walk in here. I have to stay home from work with her and the boys because she can't even get up and down the stairs.
Has the dizziness been coming more frequently?
It's almost all the time now. I can barely get around the house. It's terrible. Nothing I do makes it better.
I can understand why you would both be upset and worried. It seems to be difficult, or a difficult week actually, for you and your family. How have you been coping with it?
Miguel has been a huge help. He's with me all the time now. Plus, my mom has helped out a lot with the kids. It's not ideal, but I've been able to manage.
Sounds like you have a great group of people.
Yes, but I'm ready for this to be over.
We have to figure something out. She was fine less than a week ago. Now she can barely walk. Something has got to be wrong with her.
I'm glad you came back in, Christina. The fact that the Dramamine didn't work suggests that it isn't an infection of the tubes in your ears like I originally thought. But there does not seem to be any organic disease that is causing the vertigo. Sometimes there are other things that can cause vertigo that isn't a disease. Experiences of stress, strong emotions, or upsetting events that can all have an impact on our mind and body. We've already looked at biological factors that often cause vertigo. Now I'm wondering about other things going on that could be causing the dizziness. Christina, has there been anything upsetting that has been happening or has happened recently? Any big changes?
Yeah, the fact that she can't walk.
That must be putting a huge strain on all of you.
I'm missing work. She's miserable. The kids are all over the place.
It's been bad this week, but before that, nothing significant. I mean, everyone has stress, but nothing too bad.
It's true that everyone experiences stress at one point or another, but sometimes things happen that affect us in unexpected ways. Has anything been different recently?
Well, there's the kids, and I'm still helping out with my mom a lot, but we're pretty close, and I'm happy to do it. She's actually been doing better recently. Her blood sugar levels were out of control, so I do a lot of cooking for her. It's a pain not to be able to cook as much at home and have to travel all the way over there to do it, but it's fine.
What's going on at home that you're not able to cook there?
We're going through a home renovation. The kitchen is a mess right now because we're expanding it.
Maybe we are stressed. It's been weeks living in this disaster. It's just been a disaster.
We've had troubles with the contractor. What was supposed to be a couple of weeks has now turned into a couple of months. Is that it, Christina? I know it's a bit inconvenient.
You know, it might be a small inconvenience for you, but you get to go to work every day. I'm the one home with the kids, taking care of mom, and every day I'm just surrounded by boxes, tools, appliances, all sorts of stuff. Everything is a mess.
That sounds frustrating. It seems like this experience is becoming really stressful for you.
I can't use my kitchen, and now it's spilling into the living room. It's like I can't get away from it. I have to stay cooped up in our bedroom with the kids a lot. I'm not even at home in my own home.
I didn't realize it was that big of an issue for you. I can call the contractor again tomorrow.
We've tried that before. What is that going to do? I wish we hadn't even started this whole thing.
After dealing with this for so long, it sounds like it is really overwhelming. I know it can't all change overnight, but I'm wondering if there is some small change that could help you start to feel more at home again. Miguel, what are your thoughts?
Well, maybe we can move some boxes into the garage and tidy up a bit. Give you some more space for you and the kids.
That's a great idea, Miguel.
Yeah, I think that's a good idea. It would also give me more space in the living room to lie down and relax if I do get dizzy. I mean, it's worth a try.
Christina, how are you feeling right now? Are you still feeling dizzy?
No, I actually feel pretty good right now.
Good, good. Why don't we see if working on some of the things that at home will help you feel a little steadier? Let's see if the dizziness becomes less intense. On Monday, give my nurse a call and let me know how you're doing. We can go from there. What do you both think about that?
Yeah, it sounds good to me. Off the rest of the day, maybe your mom can take the kids and I'll move some boxes. And you just talk about what to things.
Okay, she would probably love to keep them, and we can take them over when we take her dinner. It's actually a bit of a relief to know we are finally going to do something about all that stuff.
Christina, you should still be careful about lifting heavy boxes in case the dizziness comes on suddenly. But it sounds like you have a good plan.
Yes, thank you.
Absolutely. All right, so why don't we sum up and I will document what we have discussed today. So just to sum up, you've been experiencing vertigo that came on suddenly on Monday morning. At that time, we did some tests and blood work, and as we discussed at your last appointment, considered an infection to be the most likely culprit. Since your last appointment, you and your husband have both noticed the vertigo has become more intense and frequent, even after taking the Dramamine. Is that right so far?
Right, and now I have to lie down most of the day.
Yes, I will add that. It has gotten bad, so bad that you have difficulty walking and completing daily tasks. Okay, anything else? So how would you summarize what we've focused on during this appointment?
Well, we talked about how stuff at home could be why I'm feeling so dizzy, like feeling stressed and having stuff everywhere and being so overwhelmed with taking care of my kids and mom. All of that going on for so long has gotten me worked up to the point of affecting me physically.
And hopefully, if we fix that stuff, then it might go away. Or at least start to feel better.
Okay, so environmental stressors related to home renovation and caretaking responsibilities are contributing to your progressively worsening vertigo. Since we've identified some of these psychological factors that are impacting you, and there have not been any biological causes in your exams or results that I've seen, I'm putting a diagnosis of acute vertigo with psychogenesis. Basically, this means that there is a psychological component to how this vertigo started and came on so suddenly.
That kind of makes me sound crazy.
Not at all. Feeling sick usually means something is wrong. Sometimes that we might mean that we have a virus or a broken bone or our body is not functioning the way it should. Sometimes it means we are stressed or anxious or depressed. Other times it means we have a lot going on in our lives and we're trying to manage it all. It all impacts our health. That's why at our clinic we have a whole team of medical providers, care workers, and mental health professionals. We believe it is important to treat the whole person.
That makes sense. It's just strange to think that things like that can wreak havoc with you physically.
I'm sure it is strange to hear, but our body has a way of telling us when something is not right.
That's for sure.
So that brings us to the next steps. Miguel, you already mentioned making some changes in the home to see if it makes Christina feel better.
Yeah, put some boxes away, organize things better, and give her some more space. Well, that would probably be good for all of us.
And having the kids stay with my mom tonight so we can have some time together to work on it.
Perfect. Just to add on to that, for your safety, it is still important for you to avoid alcohol and driving until we are sure the dizzy spells have gone away.
And have someone with me to help me get around, like Miguel or mom.
Yeah, and she could still take the Dramamine. I mean, it didn't work much yesterday, but I'm sure once she starts feeling better, it might be additional help.
Yeah, it might. Christina, if that is all right with you, then I will keep you on that for now. Okay, so then you're gonna call us on Monday to let us know how you're doing?
Yes, probably that morning sometime.
All right. Well, anything else before I go?
No, if anything else, we will call.
Yes. Thank you, Dr. Alwarith.
Okay, of course. I hope you both have a wonderful weekend.
During this visit, the medical clinician engaged the patient and the husband in a way that allowed the family to explore what was causing the vertigo. The physician used empathic listening to understand the situation and provides emotional support to both individuals. This case is an example of how medical clinicians can use family engagement to improve patient outcomes.